No, this is Dr. Plana from Park Avenue Lasek, Dr. Chynn office. We are in Park Avenue on 25th Street. So this is a fun thing that we are going to answer the question that the patients sometimes have. So we have a smarter patients that sometimes do like a really good question, and Dr. Chynn is responding that.
Okay, so we have our typical Asian investment banker analyst. So they always
I'm not an investment banker.
You're an analyst, though, aren't you? Yeah, so
I'm an analyst.
Yeah, the analysts, investment bankers, lawyers, they tend to be asking all the smart questions. Okay, so go on for your next question.
So so as you said, the vision improvement over the following month happened. So like right after the surgery. What's like?
So like what percentage?
Out of 100.
Okay, so what's your prescription? Minus 750, right?
Right.
Okay, so her prescription is minus 750. That means she's twice legally blind. You're legally blind at minus 3. That means you can't see the big E. You're going more than twice legally blind. Coincidentally, you have the same prescription that I had. Okay, I was minus 750, and both of us have a little bit astigmatism. You have a little bit. I had a lot. Okay. Anybody who over minus 3 has some astigmatism. A lot of people think I can't be fixed because I have astigmatism. It's not true. We can fix this. No problem. Okay. So basically, when you sit up, you're going to be legal to drive. Okay, that's about 20/50, 20/40. Okay, so as soon as you sit up from the laser, your treatment's going to take about 60 seconds per eye. It's about 10 seconds per diopter. So if you're minus 3, it's going to take 30 seconds. If you're minus 6, it's going to take 60 seconds. That's okay. So you're going to be about 1 minute per eye. Okay, that's the laser time. Okay, when you sit up, you'll be 20/50. Then we're going to check you about a half an hour later. You'll be 20/40. Then the next day you'll go down to like 20/30. Then the next day you'll go down to 20/25. It might take a couple more days to get down to 20/20, and then it might take a month to get to better than 20/20. So when we say after the safe side procedure, you get your final best vision in a month, I don't want you to think that you don't see well for a month. You'll see light glasses or contacts within a few days. You'll be 20/20 within a week, but you don't get to better than 20/20 for another month. Okay, you might never get better than 20/20. We don't guarantee that. We guarantee that you see light glasses or contacts. We're not really guaranteeing that you see better than glasses or contacts. Or I did tell you about 40% of our patients are doing so with the high definition, but that's like what I would call icing on the cake or a gravy on the steak. It's not the cake itself. You see what I'm saying? The cake itself is you saying as well as you do now with glasses or contacts without them.
Okay, and you can see like clear, like.
Okay, the reason, I've been doing this almost 20 years.
And doesn't matter how high your prescription
are. Yes, okay, so in other words,
does your level of prescription affect the outcome?
It totally does, okay? So basically, I've been doing this about 20 years. 15 years ago, if we got people like 20/25 or anywhere close to glasses or contacts, that was considered a good result, okay?
And that would be considered like negative 0.5 or like.
Well, look,
or you can't really translate that into OD.
Yes, you can. Okay, basically, 15 years ago, it would be like 20/25 would be a good result. Okay, about 10 years ago, I would say like 20/20 would be a good result. In the last 5 years, this is what the public doesn't understand. Now, a really good result is better than 20/20. We never used to see that. Okay, so basically, the laser now has the ability to go in high definition. So glasses or contacts are in quarters. -7, -725, -750. But in reality, you might not be any of these things. You might be a -7.26, or you might be a 7.32. The doctor can't do anything. You either get a 725 or 750.
And it's still considered normal.
Well, no, I'm just saying the increment isn't right. Okay, the doctor's scale, like -2, -250, -225, is not that fine. Okay, your prescription, by the way, is probably not -750. It's not -7.50. It's probably like -7.45, and then you just got a -750 because it's closer than -725. The laser has the ability to go in hundreds. We could go -750, -751, -752, -753. Okay, so the first thing is the laser is more accurate than glasses or contacts. Okay, the second thing is glasses or contacts is one prescription all over your eye. Right? You could take the contact and rotate it in your eye. You're going to say the same thing. Laser not like that. Okay. If you do high definition in Park Avenue Lasek, we take a map of your eye, and then each point on your eye is mapped with a different prescription to the 100th. 725, 2026, 727, and then simultaneously the wave scan takes a picture of your iris. Okay, the iris is very detailed, it's like a fingerprint. Okay, so it locks the image of the iris with the map of the prescription. And then as you're under the laser, if your eye twitches a little bit, it samples the image of your iris 60 times a second. And then it moves. So if you twitch a little bit, it'll just move along with the iris and make sure that the spot is accurate. The reason they have to do that now, if you choose the high definition option, is because we're putting 50 different prescriptions on each eye, accurate to 100. If we didn't map to the iris and we didn't track the movements, we could be putting 50 wrong prescriptions on your eye, okay? But when we're not doing high definition and somebody can't afford it and we do standard, it's $1,000 cheaper, then it's like a minus 7.5 all over the place.
Yeah, I mean, it wouldn't make
It
sense
doesn't
to
matter
do
financially, okay? But it doesn't matter if you move a little bit because you're getting the same prescription all over the place.
Okay.
You see what I'm saying?
Also, it depends on how the patient. So it's not so much of the machine.
Look, there are many
sit
factors.
still
Look,
or-
there are many factors going on. Okay, it depends on if you choose wavefront or non-wavefront, high definition or low definition. There's no reason to choose low definition now, except financially. You're not going to do that. Okay. The second thing is, if you're more still under the laser, you do better afterwards. Okay. The laser's got a tracker, but your final vision, obviously and intuitively, is better if the laser's not chasing all over the place. Okay. And then also, it's somewhat surgeon dependent, okay, because if you do, I've done 20,000 procedures in this one. With more technique and more experience, you're just technically better. We're going to put some videos on our website and on YouTube of me doing a Lasek and some other doctor doing a Lasek. It doesn't look remotely alike, okay? It just doesn't look the same, okay? So because I've done so many of them, I'm
So I mean, like the calibration of the machine.
yes, okay, there are many factors, okay? In other words, what to shoot, okay? We have about 10 different numbers to choose from. And I could choose any number, you know what I'm saying? And sometimes the laser chooses one number, and I override the laser. I override the laser more than half of the time, because let's say, how old are you?
29 going to 30.
Okay, let's say you're 29, okay? The laser doesn't know you're 29, and there's no place to punch in your age into the laser, okay?
Right.
So, but I know you're 29, and I also know you're an analyst, you're on the computer a lot, you're Asian, and you're smart, okay? So all these factors are myopic progression, okay? I really think that everyone stabilizes about 30, okay? You got another year, okay? So I think you're probably going to go another quarter diopter before you're rock stable, okay? So if you're like, let's say, a minus 750, you're probably not going to stabilize until, you'll probably stabilize at minus 775, right? The laser is going to choose a number on the wave scan that's going to be like minus 7.48. It's what you are now. And if I just went with the laser, it'd be fine, but then if you progress another quarter diopter, instead of being 2015, now you're 2020, and instead of a 0 prescription, now you're like minus 0.25. The laser doesn't stop the progression of myopia, it just treats the whatever prescription. So I have to use my brain. You're Asian, you're smart, you read, you're an analyst. These are all factors for myopic progression. Plus I look at your old glasses and contacts and I see how much you've progressed. I make a little curve, it's like a regression analysis, okay? And then I figure out what number to shoot, and then I'll adjust the wavefront. I'll say to Dr. Plana, hey, she's 28 or 29, not 30 or 31, why don't you add a quarter to the thing? And he'll just add a quarter to the wavefront and boost it up so that we're overcorrecting a little bit, and we're allowing for myopic progression, so eventually you're 0. Now if you go to somebody who hasn't done like thousands and thousands of these, they don't really have that experience or that confidence. They're going to just shoot whatever the laser shoots. They're not adjusting that thing. The people who aren't experienced, the thing the laser chooses, they think that's like the Holy Bible. That's not the Holy Bible, that's just a dumb laser.
Okay, this was like a safe question in Park Avenue Lasek.